Hello everyone, this is Dr. Lakshmi Nivedha and Dr. Savitri Satish Babu. We are junior doctors based at the Emergency Medicine Department at Queen Elizabeth Hospital, Birmingham. Today we are here to present about a survey that we conducted on COVID-19 and its effects on the well-being of emergency medicine physicians. We're all aware that the emergency department has an environment of high intensity stress for all its staff members. On a day-to-day basis, they're challenged with exposure to trauma, illness, death, and violence. ED physicians have historically been known to have higher rates of career burnout and stress disorders as compared to any other medical specialty. Now, with COVID happening, the general population itself is facing several stressors because of the social isolation, the economic decline, and the financial hardships that come with it. We as healthcare providers face the additional workplace demands wherein we have to function in unknown and unsafe environments. There's a pressure to synthesize new information about the virus. There's a constant uncertainty that revolves around the availability of treatment supplies and protective equipment. And of course, we expose ourselves and our family members to the detrimental effects of COVID-19. Such drastic changes have impacted the mental as well as the physical well-being, leading to negative psychological outcomes. Let's go on a timeline, beginning from a period prior to COVID-19. A survey that was conducted by the American College of Emergency Medicine back in 2019 suggested that 65% of emergency physicians experienced burnout at some point in their careers. 15 to 17% of senior physicians and more than 20% of the residents fell into the criteria for post-traumatic stress disorders according to the DSM-5 criteria, that is, the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. In the general population, the lifetime prevalence of PTSD is approximately 6.8% in adults. Certain subgroups like veterans and torture victims show increased prevalence ranging from 14 to 30%. An analysis done on approximately 1,600 emergency physicians reported that 14.8% met the diagnostic criteria for PTSD according to the DSM-5 score. So what is the DSM-5 score? It consists of 8 major categories, including exposure to death, injury, violence, intrusion and avoidance symptoms based on the flashbacks and the stimuli, negative alteration in mood, reactivity, any distress that is not attributable to substance misuse, and the above mentioned symptoms for a period of more than a month. Should the given individual experience 4 symptoms mentioned, a trained professional consult is warranted as a pathological response may be triggered. In our case as healthcare providers, such a response could have a detrimental effect on the quality of healthcare that we provide. Moving on to times that we are facing now, several studies have been done about the effect that COVID-19 has had on the well-being of healthcare providers. A few are mentioned here. The Central Manchester NHS Foundation conducted interviews on 17 emergency medicine physicians who reported that COVID-19 had affected their psychological and physical well-being as well as impacted the relationships that they shared. They claimed that they had sleep disruptions, they were neglecting their own physical needs because they were preoccupied by caring for their patients, and some also reported substance misuse. Restrictions and isolations are definitely keeping us away from our loved ones, and this has strained the relationship that we share with them. Another study that showed substantial result was the British Medical Association's latest tracker survey that was done during June 2020 while the first peak of COVID-19 was going on in the United Kingdom. More than 7,000 doctors responded to the questions of this survey, and about 2,000 of them gave personal accounts of their experience of how COVID-19 had affected them. They described the intense surroundings that they worked in with the unavailability of protective equipment and treatment supplies, and also the fear of contracting COVID themselves and passing it to their loved ones had affected them. Additionally, looking at the high death rates and seeing families bereave over their loved ones had also affected their own well-being. If we take a quick peek into previous pandemics, several studies were also conducted then to look into how they had affected the well-being of healthcare providers. One such study that stood out was the survey that was done during the outbreak of severe acute respiratory syndrome during the first half of 2003 in Toronto, Canada. Approximately 29 to 35% of hospital workers reported that they faced high degree of distress during the time, and they owed this to three contributing factors. One, obviously that they were experiencing job stress. Two, that they had the fear of contracting SARS themselves and spreading it to their families. And thirdly, there was a stigmatization and scrutiny perceived by them from the public, because there was a fear about transmission of SARS from the frontline workers to members of the general population. From the inferences obtained from the previous studies, that was the rationale on which our survey was based. We also noted that studies done during prior pandemics had also raised similar questions about the psychological well-being of physicians and staff members during the difficult situations of the pandemic. This has not been answered or addressed by us as a healthcare community. My colleague Dr. Satish Babu will now take over and take us through how the survey was done and the results we obtained and what measures were put into place.
Being frontliners to the pandemic, as well as being junior doctors working in an emergency department setting ourselves, this intrigued us an interest to explore the various options and possibilities in order to be able to contribute towards improving the current situation. Hence, we conducted a cross-sectional e-survey between the 1st of January to the 20th of February 2021 among 30 junior and middle grade doctors working in an emergency department setting within the West Midlands. Our survey consisted of 10 questions that focused on assessing different aspects of daily life, their mood, and how they perceived the stress caused as a direct result of the pandemic. The questions focused on 4 major categories such as working patterns, family and living situation, the effect on physical and mental health, as well as the effects of the pandemic on career progression. The results obtained from our study are depicted on the following slides. We noted that 55% of our participants were living by themselves, while 45% were living with their families. We were able to quantitatively assess the amount of stress undergone by our doctors using certain elements of the perceived stress score. 66.6% of doctors were noted to be under a moderate to great deal of stress, while 33.4% reported to be under minor stress levels. 40% of doctors reported putting things off for later. 20% lacked confidence in handling matters with regards to daily life. 70% experienced negative emotions several times a month. The pie chart in front of you now depicts that about 13.3% of our participants owed the pandemic to having had a direct effect on their career progression due to various factors such as redeployment, cancelled courses and conferences, as well as reduced number of opportunities during the pandemic as compared to the pre-COVID era in order to improve on their clinical skills. The slide in front of you now shows a pie chart which depicts major factors affecting the well-being of our physicians during the pandemic. As you all can see, a stark 40.9% attributed this to their working patterns, 22.7% to an unhealthy work-life balance due to difficulties in being able to access their allocated leave, 13.6% to family situation, and 22.7% to all of the above mentioned factors. From the data depicted previously as well as its interpretations, we can conclude that there was a significant decline in the psychological well-being of our frontline workers during the pandemic. Now, COVID-19 has not only affected the disease mortality rate, but has also made its effects known on extended spectrum of various aspects of our daily living. This brings us to ponder on questions that were raised previously, such as the lack of implementation of adequate effective measures in order to improve the mental well-being of our frontline workers, as well as reducing the stigmatization around it. This was evidenced by a poll conducted by the American College of Emergency Physicians in 2020, which concluded that 45% of the nation's emergency physicians did not feel comfortable in seeking treatment with regards to their mental health concerns. I'd also like to touch upon the limitations of our study, one of the factors being that it included only junior and middle grade doctors, thereby not accounting for the impact on the psychological well-being of consultants, senior grade doctors, as well as other staff members. The second factor was that it was only based on the emergency department, thereby reducing our sample size. At this juncture, I'd like to stress on the importance of mindfulness. Being healthcare providers, we need to be mindful of our own selves, our colleagues, as well as the environment that we work in on a day-to-day basis. It is also important to be aware of the programs and services which are already in place that serve to help ourselves as well as improve our standards of patient care. Some of these measures include well-being support services by the British Medical Association, which offers counselling and peer support for doctors and medical students alike, GMC investigation support, psychotherapy for doctors, as well as additional support sources for the well-being which are accessible to doctors and medical students when in need. There is also a recently launched application by the Royal College of Emergency Medicine which provides free access to a mental well-being platform for frontline workers during the pandemic. We'd also like to take this opportunity to encourage our medical fraternity to improvise and implement new strategies for well-being. I'd like to talk about a few well-being measures which were implemented in our own trust and local department. During the last 8 to 12 months of battling the pandemic, we were able to establish a well-being hub and a positivity room which served as a focal point for various staff members when experiencing psychological distress during their daily work routine to unwind and engage with each other with social distancing measures in place. There is also a 24-hour hospital helpline which offers psychological support to those physicians in their times of need. We were also able to implement coffee and chat sessions with the goal of bringing together various staff members irrespective of their hierarchy, making it possible for everyone to bond. This in fact helped reduce the stigmatization around mental health issues to a certain extent as well. I'd also like to quote the references that we were able to access in order to enable us to put this presentation together. Finally, to conclude, we'd like to thank our mentor and guide, Dr. Sarafina Vatarkar, Consultant Emergency Medicine at Queen Elizabeth Hospital, Birmingham, as well as University Hospitals Birmingham NHS Foundation Trust, and also Eurasia Research for providing us with this wonderful opportunity. Thank you.